Welcome everybody, and let's go to our next slide, please. So where are we heading today? You've just been through a bit of an orientation and welcome. We'll start the opening plenary now, which includes an address and some interesting thoughts from Dr. Sebastian Taylor. From there, we'll take a break. So you will have a chance between our opening plenary and the first roundtable to grab another cup of coffee or do what you need to do. But we will be moving steadily through this opening plenary session. Moving on, please. Great. And next slide. Here we go. So welcome. My name is Hugh Brewster. I'm based in Toronto. I'm here on behalf of the Circle Club professionals. The other hosts who are going to make sure that our event comes off well, that you get the orientation that you need. If you get lost, these are the people who will help you. My colleague Niti, who's just over in the same room as me, Kiara and Christian, and you'll meet some other members of the team through each of the roundtables. Excellent. So this is the time. I warned you this would happen, but we do have the interpretation button there. If you would please, everybody, just click on that interpretation button, select English or Spanish, whichever one you're more comfortable in, then you'll be ready. Unfortunately, you have to redo that every time you enter a new meeting. So the same thing we'll ask you to do when we get to the roundtables and then back at the end for the closing plenary. Excellent. Well, we wanted to start off with a quick poll. Niti, tell us a little bit about what we should hear from everybody. Again, as I mentioned, this is an interactive conference. You're not here just to turn your brain off and listen. We'd love you to be active in shaping the future of comprehensive cleft care. And how are we going to do that, Niti?
Absolutely. We want to really know you all more. And so we're going to have a very quick 30-second poll for you. 2 questions, and I'm going to be launching the poll right now.
All right, so everyone's got their clickers ready.
Okay, here you go. 2 quick questions. Which of the following options best describes what you see out your window right now? And the second question, which of the following best describes the status of year-round comprehensive cleft care in your region?
All right, so I've got some music here in the background. Doo, 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 doo. As we wait. This is just the top of your head. Shouldn't require a ton of thinking, but please do vote. And it sounds like Niti, you need to speak up the next time you speak, so that's fine.
Sure. Sorry about that.
Thanks, Panawan. Okay, yeah, we hear that Niti's volume was low for some reason. Well, we'll fix that up. But just she was inviting everyone just to complete these 2 quick polls. And we'll ask you, we've got like maybe 5 seconds left.
That's right. I can see the responses coming in. Nearly there. I can see that most of y'all are on the second question now.
Oh, you've got some extra information, Niti.
Great. So we are going to close the poll in 5, 4, 3, 2, 1, and there you go.
All right. Well, please share the results, Niti. How are we doing? How are we feeling? Okay, can we have a quick around the world? It's still dark and early, 15%. Half of us are having a sunny day, 26% cloudy day, stormy day. It's already dark and late, so the sun's already gone down for 5% of us. And there is 1% of us, 1 or 2 people who are saying, I have no window. I don't know what you're talking about. So excellent. Very good. And then the second piece, you can see we're at different stages around the world. And I think I want to emphasize that in terms of comprehensive cleft care at the Circle Cleft Professionals, we see this as a journey as opposed to a destination. So you can see there are some of us who are just getting started. Some of us who say, in the big cities, we are already on our way. There's at least half of us who feel like we've got a lot to share. We've got something well established and we're growing. And then there's a few of us who are saying, we're actually kind of, we made some progress and we're starting to see that slip. And then finally, we've got 10% of us who are saying, I'm just here to figure this out. I'm not actually an expert in any of this. And that's great. You're in the right place. So that is part of our global community. We're here, whether you're just getting started, whether you're losing steam, or whether you're here to learn, you're in the right place. So Niti, thank you so much for that poll. Let's move on to our next slide. And that is, I saw his tap dance here. All right, a big thank you. So, as I mentioned, the Circle of Cleft Professionals is a collaboration among some leading Cleft NGOs around the world. We're thankful to them for making this possible today, for making this a free conference for us all to join. So, if you see one of the movements that you're part of, make sure you say thank you to that leadership of those movements for making this possible. We'll move on. And we also want to give a shout out to our advisors. You'll be hearing a little bit more from them at the final plenary, but all the way along, they've been shaping what we've been up to. All right, and this is not the first time we're doing this, although many of you, this may be your first experience of both the Circle of Cleft Professionals or the Solutions Conference, but just again, if you can use that reaction button at the beginning, if you were here at the very beginning, so during COVID, and again, this whole conference came when my colleague Felicity had to make the hard decision of postponing the Edinburgh Cleft Congress, and we said, what can we do in the meantime? So that we quickly pulled together the very first Solutions for Comprehensive Cleft Care Conference in 2020, responding to COVID. We followed it up a year later about moving in from COVID into the new phases of comprehensive cleft care, and we'll move on. But please use a reaction button to show me if you were around for one of the first couple comprehensive cleft care conferences. Please use a reaction button to show us. Very interesting. Okay. Many of us saw each other for the first time face to face. Many of you discovered that despite my big voice, that I'm actually not super tall in Edinburgh, and I saw many of you processing that. So if you saw me there in Edinburgh and realized I'm not the tallest guy in the world, that could have been the first time we met each other, was at Cleft 2022. And then we followed up from that conference in Propelling Learning through Collaborative Research in 2023, and here that brings us to today. So next slide, please. Today, we are focusing on 4 key topics: effective community-based CCC, making the case for core CCC, multidisciplinary CCC team building, and supporting parents in CCC treatment decision-making. You hopefully heard a theme here. Comprehensive cleft care is at the heart of everything we do. And we pulled together some leaders from around the world to identify and test some practical recommendations, and then to present them today. So we're halfway there. What's going to happen after this conference is documenting some of this learning and the results so that you can talk about this with your team if you have one. And if not, maybe you can start finding a team to be able to put comprehensive cleft care on the front burner for families affected by cleft around the world. So who are the amazing people that we recruited this year? Look at them. Amazing, fantastic. You'll hopefully see some people on this call and people you know, but they have joined and been meeting faithfully from January all the way to today. In the dark and early, if you're in Seattle, or in the dead of night, if you're in Thailand, these are the folks who joined us. Next slide, please. You can see we are quite diverse, all the way Australia, all the way to Zambia, and I swear we didn't recruit David or Pumalo just because we could say A to Z, but that did happen. So you can see here we've got some great representation. Next slide, please. And then we were also quite diverse in terms of cleft disciplines. So as expected, speech therapists leading the way, surgeons not far behind, but we're delighted to have social workers, researchers, cleft coordinators join us, and everything in between. So hopefully when you hear the recommendations today, you'll be able to say, aha, I can tell that someone who's associated with my discipline was involved in shaping these. I see myself represented in this. Now, obviously, there are many other disciplines who are not there, but we feel pretty excited about the level of diversity that we have within a comprehensive cleft care movement who are shaping our discussions for today. Next slide, please. So we were on a bit of a journey. As I mentioned, from January to March, we call it a sprint process. Our first meeting was on January 16th, and that brings us all the way to where the solution group members will be facilitating our discussions today on March 20th. We can see that a key element of this was drawing in some input, not just from the solution group members, but from around the world. So we had responses within a 1-week period, so a very short constrained time, but we had 465 responses, our record for us, amazing, from 49 countries. The majority of whom, as you can see, are from low and middle income countries. And that survey was available in English, Spanish, and French. So that's true for all the roundtables you'll be part of today. This is some of our overall stats. And then that brings us to this. So we say we're going to be drilling down and really looking intensely on the practicalities of what comprehensive cleft care looks like in a low and middle income country. But we want to start our view from outside cleft. So Dr. Sebastian Taylor is not a Cleft professional. He heads the Global Child Health Program at the UK's Royal College of Pediatrics and Child Health. His work focuses on health systems development, including then how Cleft fits into those health systems. So he's been involved in work in India, Pakistan, Myanmar, Nigeria, Rwanda, Sierra Leone, a bunch of other countries. We're delighted for him to be here today. Prior to his tenure at the RCPCH, he was executive director of the IRC, the International Rescue Committee, and Landmine Action. So lots of really interesting experiences and leadership learning that he can share with us that really applies, I think, to Cleft also. And he has some experience, which he'll share, I think, in a second, also with just thinking about how Cleft fits into this big picture. So we wanted to start today with our wide aperture, Cleft within the big picture, quality care for mothers and newborns. And then by the end of the day, the closing plenary, we were ready getting down to the nitty gritty. How do we apply the insights and learning that we had today into our own teams, into our own regions, into our own health systems in our own countries? So that's where we're headed. Without further ado, Dr. Sebastian Taylor, are you with us?
I am. Oh, look, there I am.
Fantastic,
Actually,
it worked.
My face as well.
We're delighted to have you here.
Thank you very much, Hugh. Okay, well, I'm going to push straight on. Thanks for the introduction, Hugh. These introductions are always a little embarrassing, but and I have to say I'm slightly intimidated by the scale and breadth of the group today, particularly insofar as I am a little bit of an interloper. I'm not a specialist in Cleft. It's important to say that the work that we do at the college is really on improving the quality of clinical care for mothers, newborns, and children, with a real focus on secondary level care. That is to say, the sort of equivalent of the district hospital, which sits between primary facilities and more specialized tertiary centers. And one of the reasons we do that is because I think if you look at health sector investment in low and middle income countries over the last 30 or 40 years, what you see is quite a large volume of financing going into community and primary care settings. The tertiary settings tend to take care of themselves because a lot of that is privately driven anyway. And there is a very significant amount of underinvestment in the secondary level of care. And this is a problem because the secondary level is really where the next 25 or 30% of mortality reduction is going to come from, with more severe cases of fever, of trauma, of injury, of other kinds of newborn and pediatric problems. And so our work is a relatively modest contribution within this area, but I wanted to talk to you about it today because I think in discussion with Hugh and with other colleagues, particularly colleagues working in Ethiopia, we've started to think about how identifying Cleft, how recognizing the problem of Cleft and other birth defects or anomalies can be situated within the broader health system function, and thinking particularly about that patient pathway from community all the way through the hospital setting, back out to the community. Again, next slide, please. So this is a really very simplified schematic of how we would approach a district hospital, say in Rwanda. I think this comes from our work in Rwanda. The middle part really shows you the stages, the stages of the patient progress from the health center where they are reviewed. The mother comes through admission into the hospital, through delivery, and then onto the postnatal ward, hopefully with their baby. At the top, you can see where we are identifying what Americans used to call the interdiction points. That is to say, gaps or weaknesses that we can identify in service delivery quality or service delivery capacity and function. And then at the bottom, the kinds of adverse outcomes that we see in, excuse me, in clinical terms. What we seek to do then, what we seek to do at the college, if you go back a slide, please. Yeah, so what we seek to do here is to design integrated interventions along this continuum of the patient pathway, where we think you get an aggregate amount of benefit. And in the case of Rwanda, what we've seen in the hospitals that we work in the country between 2017 and 2023, we saw a neonatal mortality reduce by around 50%. So I think there's evidence that adjusting the quality of care through a sort of integrated approach to systems delivery can produce very good outcomes. Next slide, please. But one of the consequences of mortality reduction amongst newborns is we know that of the larger group of newborns who are going home with their parents, a significantly larger proportion will be going home with problems. And the question is the system as it's currently construed, and by that I mean in this case the district hospital itself, equipped to identify, to pick up on, to understand the nature of those problems as mothers and babies go home, and therefore to be able to support follow-up, which helps those babies beyond survival into early child development and into child development and thriving, which is really, I think, where the interests of Cleft and the interests of newborn survival coincide. The question then is, how can you leverage one to support the other? Next, please. So what we've been talking about with Hugh and with colleagues in Addis more recently is are there ways in which we can strengthen the exit point of the hospital? In other words, some sort of more systematic approach to a protocolized newborn assessment before the mother and baby go home, on the basis of which you then have information about problems amongst newborns which can be understood and followed up. At the moment, I think it's fair to say, from the group in the room, there will be some countries where this is being done routinely and being done well. But there are quite a lot of other contexts, particularly in the low or lower middle income country settings, where newborn assessments are not being done at all, or they're not being done systematically. And one of the consequences we know, when you don't have any data, there's no real pressure for action. And so one of the things that I think we would like to do from the college's perspective is to work with colleagues in hospitals to improve the pre-discharge assessment of newborns, because that will help us to work with government to develop longer term support. Next slide, please. We know, and I think this group will know much better than I do, that now is a moment when what happens with newborns leaving hospital is becoming acutely interesting to international organizations, to donors, and to governments. This is a real opportunity to bring together the understanding that saving lives in hospitals brings with it new ethical challenges, new practical challenges. How do you then support those babies and young children to develop well? Particularly at the end of last year, well, I guess through last year and early this year, we see some particular signals coming out of the international community. I think you'll know this better than I, as I say, but the second edition of the birth defects surveillance publication from WHO, which came out at the end of last year, at last year's World Health Assembly, a resolution reinforcing government's commitment to support SDG 3.1 and 3.2, which includes a commitment to improve newborn assessment at the point of discharge. And then in the Southeast Asia region, WHO are rolling out guidance on newborn assessment across their countries in a trial phase. So it seems to me there are some movements in the international community, both on a policy side and on a financing side, to strengthen newborn assessment. And within that, there is an opportunity for the Cleft community to build up understanding and attention to what is happening to those children of interest. But let's assume, in the last part of this discussion, let's assume that we are successful in establishing and rolling out the principles of newborn assessment at discharge for the majority of newborns going home. That then brings with it a whole set of questions, which I think the Cleft community is already thinking through. But I think, structurally, there's an opportunity again to think through, well, what does this mean? What kinds of policies should we be promoting or advocating for? Next, please. Because on the one side, you have babies going home with their mothers And the question is, what can be done to support those mothers, to support caregivers in the household, in the community, when confronted with problems, including those relating to Cleft? What kinds of educational supports can be generated prior to departure from the hospital? Or indeed, what kinds of educational supports can be provided or supported within communities where caregivers and parents are confronting challenges in the home? Next, please. On the other side, of course, there is, and I'm speaking outside my realm of expertise, but there are a number of options relating to therapeutic intervention. Particularly, I'm thinking about surgical and clinical interventions. And there, of course, the question is, well, what does the Cleft community think about how that gets structured? Who covers the cost? Should the cost for these kinds of interventions be incorporated into health insurance packages? Because we know that some countries are really pushing out. Rwanda, for example, has done extremely well on a health insurance package for the population, but it excludes a certain number of activities. And one of those that may be excluded would be, for example, high-cost surgical intervention. So there's a question about how the costs get covered from a government or health insurance side. If the costs are uncovered, what does that mean about who can afford to pay? And what does that mean about equality or inequality in relation to accessing surgical options? Access, of course, has a broader issue. We may find that assessment, understanding, and intervention on Cleft is good in large urban centres, in large tertiary hospital facilities, but is actually very weak when you go further out geographically into the smaller hospitals and health centres. And then the question is one of not just financial equity of access, but also geographical equity of access. And again, I think there's a really interesting question here for the Cleft community. What is your thinking about how you would want to advocate governments to structure making those kinds of options available? And then, of course, the last one is uptake, making sure that, going back to the educational piece, parents and caregivers feel confident that they understand what is possible to do with kids who have Cleft in order that they are willing to make the effort to get their kids back into the system. And then my final piece on this, next, please. And next, sorry, that's my PowerPoint skills at play there. Yeah, so then the question is, who is going to do this and in what way? Evidently, we know that in some low middle income countries, government is really taking a leading role, both in financing and in institutional development. We also know that in others, not so much. And I've been recently in both Rwanda and in Nigeria looking at early child development, and the difference between the two is stark. In Rwanda, we see government really starting to lead very strongly on post-discharge welfare conditions for young children as they grow. In Nigeria, by contrast, we see this is relatively unattended from a government perspective. Now, this is not a matter of blame. This is a matter of where priorities are and what governments are thinking about. But I think there is a question for this community as well, which is when advocating for a more coherent approach to supporting families with kids with Cleft, who are we asking to do what? To what extent are we going to be asking government to step into this place? And to what extent, for example, may we need to look at civil society actors, non-government organizations who often fill spaces government can't do? And also, to what extent is there an option for leveraging community capacity around these questions? I'm going to stop there, if I may, Hugh, with just one final observation. Having raised a number of challenges, which I grant you may be quite irritating for a group of people who spend a lot of time in an area in which I'm not specialized, it does seem to me that one of the reasons I think Hugh and I talked about me coming into this meeting is because there is a signal opportunity right now to bring together a lot of the investments in newborn survival, which are going to carry on over the next 5 or 6 years, notwithstanding the disruptions in the aid environment that we see. They are going to carry on. And within that, what we're seeing is a building out, not just of clinical survival for newborns, but of welfare and care in the longer term. And in that, I think there is a real space for Cleft to situate itself more prominently, engaging with all of those actors that I talked about just now. Let me stop there and hand back to you. Thanks very much, Hugh.
Thank you so much, Sebastian. Lots to think about there as we're positioning that beginning stage, that initial piece where a family learns that their child has been affected by cleft. Most of the roundtables that we're focusing in on today then takes it into that next piece, post-discharge, part of those therapeutic follow-up options that are moving there. But Sebastian, thank you so much for situating us, and particularly the pivotal moment that we're in terms of, as you and I discussed, some of the changes in aid funding, some of the other elements. How does Cleft position itself well for saying that with timely intervention, some of these elements of post-discharge home care can lead to children affected by cleft leading a full life, being fully represented in society, which is what you'll hear in all these roundtables. So I'm really grateful for how you set the stage for us today, Sebastian. I see that Sophie has published, from your organization, a course on cleft palate examination in the newborn. Really helpful to understand that that's a resource that's out there as we look and continue to think how we together can move forward in ensuring that families have access to all the care that they will require in order to really see their child live a full life. So we're delighted for this. Now, Kiara, can we move on? We do want to let you know a little bit then, once we've now hit this big picture, how we're diving in to discuss a little bit more in the nuts and bolts of how this looks across the world. Each of the roundtables that you'll be able to be part of, we'll start off with a bit of an introduction and move right into some overview of what they learned from their survey, from their discussions, from their research, from the foundational articles that they explored. And then we're going to leave a lot of time for interaction. So that's a chance in these smaller groups for you to talk a little bit about what you're learning in your context, what some of your questions are, to interact with the recommendations that they'll bring forward and see, will they work in our context? What would we need to change? And then the total time for these roundtables is 70 minutes. So not a ton of time, but there's a lot of a chance there for within the chat, within the reaction buttons, and within actually asking questions for that interaction and dialogue to continue. Let's move on to the next slide. So coming out of here in just a couple minutes, you have a choice to make. Will you like to discuss and hear more about effective community-based CCC interventions? So that really builds nicely on what Dr. Taylor was talking about. Or are you also talking about making the case for core CCC disciplines? Also, that sense of once we establish in the data and build that pressure for saying why there is a requirement to have these cleft teams operate and the advantage that they can have for the whole health system, do you want to learn more about and discuss making that case for core CCC disciplines? Maybe you're in a place that has some surgery options, but not much else. This might be the one for you. So you got a choice, SG1 or SG3. We'll be starting those in about 5 minutes, and then we'll be taking a 15-minute break to catch our breath. After that, Kiara, where are we heading next? Then we'll go right after a 15-minute break into Roundtable B, where you have another choice to make. You can either talk a little bit more about multidisciplinary CCC team building, or you can talk about supporting parents in CCC treatment decision-making. So those are two key topics. You have to choose one or the other to jump into. After that, we'll take a 5-minute break. And where do we end up? Well, really, as I promised, going right back into practical CCC tools. So do come back in a few hours to talk a little bit more about how we'll end our day, what comes up next, what stood out, and then how do we make sense of going from the big picture all the way down to the nitty-gritty. So that's a little bit of our outline. Next slide, please. So to get from here to there, we've got a quick video. Hopefully the sound will work on this. If not, Niti's going to jump in and explain what's going on. But this is going to explain on the Circle app, how do you get to your next roundtable in about 6 minutes or so. Kiara, let's see if this works.
You're right now in the plenary room. In order to move to the next conference session, you will first need to move out of the Zoom call by clicking on Leave in the bottom right-hand corner. Once you do that, come back to the Circle platform. On the left, you will see Enter the Conference. Click into that space. The next session, that is Roundtable A, you will see that right on the top. You need to select one of the two sessions that you would like to attend. Say I select Making the Case for Core CCC Disciplines. Then I will click into that. On the right here, you will see Join Virtual Event. That is the link that you need to enter to move into your Roundtable session. Good luck and see you there.
All right, so it's been a quick journey for us here as our opening plenary. Now we'll get into the heart of things, which is the roundtables. Feel free. Next slide, please,
You're right.
Kiara. So right now, you've got a break, 5 minutes to figure out your lesson. 5 minutes. We're going to get started in about 1 or 2 minutes. Go right into the next piece, which is choosing either effective community-based interventions or making the case for core CCC disciplines. And please join that next meeting. If you get stuck, stick around here, and Kiara and Christian and I will help get you started. Thanks, everybody. We'll see you in a few hours, and then see you in the roundtables. From roundtables to practical CCC tools. So please, we're at the appointed hour. Oh, I think we've got 2 minutes left, it looks like. So let's go on to the next slide. That's fine. Perfect. All right. So on this case, as I mentioned off the top in our opening plenary, we have benefited from the insight and expertise all the way along from our very first S4CCC conference in the height of COVID, when we were all locked down and just figuring out Zoom for the first time, all the way to today. So 5+ years, we benefited from the advice and input of these advisors. And now I'd like to call on them to kind of bring things together. So next slide, please. So what stood out for you about the roundtable discussions? And then probably we'll have a chance to hear from the rest of the group. So Marina, you were the first on in our plenary from Santiago de Chile in a center of excellence in the Smile Train movement of a comprehensive cleft care center in Santiago de Chile called Fundación Gantz. Marina, tell us a little bit, you were part of both roundtables, you were part of an SG group. What are some of the themes that you're thinking about as we move from this idea of, these roundtables all the way down to some practical ways we can move forward?
Yeah, well, in our resolution group that was about the effective community-based comprehensive cleft interventions, we are all meant that we really have to embrace all the actors in this area. So we have to work together not only with governmental institutions, but also with community-based organizations, so we can have the support of all them in the different communities to educate families, to educate patients and parents, to get a better result in the treatment, and to diminish the burden of care. That was one of the main topics, I would say, to resolve and to find solutions for.
Thank you, Marina. And yeah, I think we can stop sharing now, Kiara, so we can all see each other. Yes, so I think that comment, the topic that was not part of our previous S4CCC discussion at all, but which is really, I've heard resonated through a few different SGs, is that sense of burden of care. What are we asking of patients in terms of access to not only a safe surgery, but now we're talking about some of the other elements that will allow them to achieve full rehabilitation. And Marina, that really stood out for you in terms of your SG role. Very good. Let's keep going to a different continent. Dr. McConnon, you had a chance to share in one of your SGs, but tell us a little bit more about what are some key things that you're taking away from the discussions that you heard actually in Ethiopia this afternoon.
Yeah, thank you very much. It was really, I got the chance to participate in most of the activities S4CC. And this forum brought providers from all over the world, I can say, a different level of experience. The experienced shared their experience generously. I'm grateful for that. I think, I feel now the era of only surgery is phasing out, and the era of multidisciplinary care is developing. So this is really very, very important. Some of very important things which were discussed was one of the which impressed me was that about integrating the cleft care into the existing healthcare system, and this is really very important for sustainability. That is really very, very important. The importance of year-round comprehensive cleft care is also raised and discussed, and this is also very important for low and middle-income countries, because the experience which existed was surgery only and mission-based, and no follow-up, no other activities. So this forum has also opened an eye for many of us, so that cleft should be cared in multidisciplinary care. And one very important thing which really contributed to the equality of care is what Sebastian mentioned, the newborn examination. That leads to timely diagnosis and timely counseling and timely care. In a review we did, the majority of patients received primary surgery beyond the recommended timeline as other parts of the world, as in high-income countries. And really, this contribute to the outcome. And the outcome will be really not equivalent to what a cleft child treatment outcome in high-income countries. So this is really very, very important. And we are also involved in this activity. Thank you to Transforming Faces, Transforming Cleft currently. I'm really impressed by the activities, by the generosity of the professionals to share their experience. And I feel lucky, and I think the cleft care in this part of the world will be improved. And the children born with cleft will get all the services, and their outcome will be as equal as any child born in other part of the world. Thank you very much.
Mhm. Thanks, Dr. McConnon. Lovely to hear a surgeon celebrating the era of surgical-only care receding, and then a new era of multidisciplinary care being the norm dawning. And we saw some likes on the chat for that. Awesome. Also to hear about just that importance now that there are options available for at least surgical care in so many more centers, and we saw that in an initial poll off the very beginning. Then we can focus on some of these ideas of referral. I mean, what's the point of having a really good newborn evaluation that equips parents to understand that they have a cleft, if there's no pathways to treat them? Is that even ethical to think about that? So I think as we see centers develop with the expertise, then that sense of referrals is so important, because there are pathways, there are places where families, even low-income families, can access care, good quality care. And then from there, Dr. McConnon, we know your team is at the forefront of building out, saying, well, then beyond that, what are the other limitations that are holding children back? Is it clear speech? Is it orthodontal care? Is it oral care? Is it nutrition, etc.? So those are some really helpful insights that you drew in, and I resonate with the idea that there is that sense of a global community sharing resources, that we're not stuck, even if we feel like we're the only comprehensive cleft care person or team in a whole region, that we're not alone. We don't have to reinvent all the wheels, that there are lots of learning of things that are consistent, even in contexts that are quite different. So lovely. Thanks, Dr. McConnon. I see Felicity, you nodding. Please, we'll go for our third continent in the UK. What stood out for you? And especially as you had a leadership role in terms of our Cleft Congress that happened in Edinburgh, what kinds of progress are you hearing from the discussions that we had even 3 years ago to the conversations that we're having today?
I think firstly, the ethos that every single topic was a cross-cutting theme that every single discipline could be involved in. We didn't have discipline-based silos. And I think that is increasingly happening, and a really, really good thing. We benefit from the diversity of opinions. We learn more about our other colleagues, and we learn a little bit about their work as well. Earlier, I think Brian or someone was talking about everybody having a role in providing some psychosocial support. So unless we interact with each other, that doesn't happen. And despite the huge diversity of professions, there was such a lot of consensus about the challenges, be it high or low income countries. There's a lot of similarity. Many of the solutions were quite similar in that it boiled down to culture. It boiled down to education of the patients, the parents, the public, and the team members. And of course, there's an element of funding. But a lot of the things we talked about, some of them are not necessarily requiring a lot of funding. We heard about how the smart thing to do and the sustainable thing to do is to piggyback and integrate into existing government frameworks. And that requires collaboration, thinking about things. It doesn't necessarily need a lot of money. So I think that should fill us all with a bit of hope. And it also shows that we don't work in a vacuum. We've got to see clefts as part of a bigger, wider picture. And again, with implementation, I think I saw many places the term co-creation of resources, not just with the interdisciplinary team, but with the stakeholders, the mums, the dads, the public. And that philosophy of co-creation is beyond critical. And I love the interdisciplinary participation. I think there was one discipline that wasn't present, but it was well represented in that most cleft services fall apart without a coordinator. And I have to say, none of these solution groups would have worked as well as they did without the phenomenal coordination. We worked with Danica. I know the other three groups had people. And honestly, it's so easy to underestimate the importance of someone herding the cats and keeping us on track. Similarly, in a cleft team, if somebody's not managing appointments, data, it all falls apart. And I think that is one area where funding isn't spent enough. We don't get enough funding for that. But yeah, not all solutions need a lot of money.
Thanks, Felicity. So an important question for those of us on the NGO funding side of things to wrestle with is, again, how does that coordination piece fit into a funding envelope? Is that something that's available to teams? How do we talk? We talk about, what are the SGs talking about advocacy for year-round care? What role does that coordination piece fit in? Who picks it up? I know there's a bunch of teams I know on this call who've been wrestling with that. Really helpful. But also thank you, Felicity, for weaving in the idea that there are some themes or some things that can be done, especially if we look back to when we started to now, even with the fluidity of using online collaboration, things that don't cost a lot of money, but can really help a team make leapfrog forward in terms of their ability to implement comprehensive cleft care. Thanks, Felicity. All right, our fourth continent. Professor Rupa, I know you're not in that continent right now, but please tell us a little bit about what stood out for you and some of the changes that you've seen over time in terms of these roundtables leading to concrete CCC tools and progress.
Yeah, thanks, Hugh, and thanks to everybody over here. I cannot, but agree with some of my colleagues who just spoke up before me. I'm really comfortable where I was today because the first, solution group conference, I was a plenary speaker and I was petrified. So, from there to being here, I've really gotten comfortable. But what's been amazing to me is that all of these cleft charities, the 10 or 11 of them have remained invested in this cleft, this conference and this discussion, because it's obviously important to all of us to be able to talk beyond each one's clinical skills per se, because taking care of children with cleft is much bigger than that. And like Felicity just said, having everybody in a space where nobody is the real expert in that space is really important, because you can be vulnerable and yet you can contribute. So I think that stood out a lot to me. And truly, Hughes, 8 months ago, when we started talking about this conference, I remember how much discussions we had about what could be topics and, what would happen. And I kept thinking at that time, do we have overlap on these topics for this year? Were they sufficiently different and yet thing? And it's amazing that each one blends into each other, but each one has lessons of its own. So I think when you put them together, there will be a very strong CCC multidisciplinary, involving every stakeholder, in that little book or manual, possibly a manual which, anybody can take forward who are starting teams. I just love the process because every time in the S4CCC, I work with a different set of people, and I not only make new friends, but I get such I get such a different point of view on the same goals we are all working at. So I think that's really fantastic. I really enjoyed that process. Even though I had to wake up at 4 o'clock for this meeting, it was worth every minute of it. And really huge congratulations to every coordinator. We wouldn't have been able to put anything if we didn't have, all the people who helped us put all the discussions together. I think that was really fabulous. Thanks for letting me be a part of this, and I truly enjoyed it. Yeah.
Thanks, Professor Rupa. Wonderful. So again, some of that sense of the collaborative element that I think we are pretty unique in that sense. As much as I've been commenting on all the different SGs saying, yeah, Cleft is not the only one there. We can learn from other elements of the health discourse. And Professor Sebastian at the beginning was pointing that that Cleft is just one part of health systems. I think I want to recognize Brian Summerlad, the chair of of Cleft, Bridging the Gap in the UK, pointing to some other topics even for future discussion. Like what is how is the funding that NGOs provide actually potentially discouraging some of the growth of CCC? What is our role as NGOs within all this? And I think, yeah, there's lots to explore there. And I think if anyone else has comments, this is the right time to be thinking about next steps. And so the chat is a good place to do that. But we do have one other person I'd like to hear from, someone who's been involved in both the UK as well as NGO partnerships around the world. That's Debbie. Debbie Self from a little bit further south from Edinburgh, from London. Debbie, tell us a little bit about some of the themes that really stood out for you as someone actively invested in these discussions along the way. Well, you're still on mute, Debbie. Right.
Thank you very much, Hugh. Well, it's been a fascinating afternoon, and you do think, oh gosh, I wonder what was going on with those other talks. So you've got this complete overview, and it's great that we'll be able to go back and see those. For me, one of the things that I really liked was, I don't think I've ever talked about shared decision making in a team. And so this was in SG4 was a very, very new topic. And so that for me was very stimulating. And I learned a lot from just the discussion, the readings that we were asked to do. So that was very good. In the actual roundtable, and the roundtable discussion was amazingly good. I mean, there was lots of wonderful participation, loads of information. And I think one of the things that struck me was the differences between high-income countries and low-income countries, and particularly the presence of the psychologists. So the descriptions of what was going on in high-income countries was very, very far away from the discussions we were having about low and middle-income countries in our group. However, it was lovely having psychology there to actually, and comments around actually, I think Kate Lamarchal said, the principles of psychosocial care are universal. And actually we can all learn and be able to take some bit of training and know about the principles of shared decision making and be able to apply those principles. I think this issue of training is repeated probably throughout every SG actually, and the need for tools and the need for us to bring our tools together. And that was a very important thing. The importance of getting the views of the children and young people, which is, we need to use creative methods to do that, and the parents. And that was something way beyond the remit of a 2-month group for shared decision making. But our colleagues from the parent support groups and their experience also was very valuable in that area. So I think one of the things I think is we think of a different topic for our conferences each 2 years. Should we not now take some of the objectives and the need for training packages, the need for resources, and maybe think about coming back to some of the subjects we've already explored and reflect on, okay, these are now available. And this is some what's happened since we did these, because I sort of feel that we've just at the very, very beginning of shared decision making, and that might be a way of making sure we sort of complete the circuit somehow. So incredibly stimulating as ever. Huge congratulations to Hugh and your team. You've all been amazing as ever, making all of this technology work. It's fantastic. But actually the participants today have been amazing. I've just, blown away by so much information to think about. Thank you.
Thanks, Debbie. Wonderful. And yes, this is the right time to be thinking about what should we tackle next. And I take to heart Debbie's admonition to say, hey, maybe the next thing we should tackle is actually a recap and going further and identifying some of the progress that's been made, but also some of the areas where we've just scratched the surface, and so much more dialogue and work could be helpful to explore. Kiara, I'm going to ask you just to share our screen. Thank you to our advisors who are on the call in terms of giving a little bit of a feedback. I do want to hear from everybody else too. So we have a few minutes here. And I think if we go back to the next slide, please. And again, as we thank technology, before we go to that, actually, let's just, before we'll hear from Kiara in 1 second, but just where you are right now. I mean, you've heard a lot of different ideas. You've intentionally poking around on Circle, looking at some of the resources. We just heard from some of our advisors. On your own, type into the chat. Don't hit enter just yet. But what stands out for you? What's a thing that you are most interested in taking further and thinking more about and bringing back to your team and studying once the recordings are available? What's that thing that really stands out for you? So don't put enter just yet. We'll all type those in. I'll give you a second where I will not talk so you can put your thoughts together. But what's that one big thing that's standing out for you? Okay, when you're ready, I'm going to give you a sign and you can all hit enter and we'll hear a bit of a waterfall along the chat. Now you do want to click the chat button if you haven't yet, so you kind of see this there. But I think this is important to record. We had some requests in some of the other roundtables saying, hey, I would like to get access to this chat. Yes, for sure. Circle is the place. Niti will give us a quick overview of what the Circle platform is all about if this is your first time. But yes, we do want to capture and not just sort of be circling the surface of things and then leave it forever, but be able to come back and hopefully have people build on this. And we'll talk a little bit more about how the roundtables will be built upon. But in 3, 2, 1, if you get to enter. So I see strategic alliance. I see library of shared apps. How do we help build leadership qualities in CCT team members? Lovely. Sustainability, says Nico. Shared decision-making, so much more to do. Dedication, advocacy, says Mohammed. Yes, that sense we had SG really focused on there. The importance of meeting together to discuss for patients. Yes. Shared decision-making again, co-creation, Holly. That's a new term. We haven't explored that in S4CCC before. Again, back to this library of what we already know, collaboration, that sense of resources, definitely lacking resources. How do we address that? Savita also on sustainability, recommendation, publishing, research, yes. Advocacy, again, another interesting thing, the importance of collaboration. Lovely. These are great. So we will include all of these. Thank you for participating in this part. And as we talk about our next steps, one landing point for these roundtables and these discussions will hopefully be our great big gathering point, the Cleft 2025 Congress. So I'm delighted to introduce, and we'll go to the next slide, Kiara, that Chihiro Sugiyama from the core organizing committee, and she's the treasurer of Cleft 2025 in Kyoto. Kiara, thanks for staying up so late. I know it's past midnight or almost midnight in your context. That looks like dawn in your background, but I think it's quite dark where you are right now.
This is a view from my clinic. So I because I love this picture, I put it on my background. Thank you. And
thank you so much.
May I start? May I start now?
Tell us a little bit about what's coming up in Kyoto and how might this kind of research be represented in our international gathering of the Cleft community.
Okay, thank you. And in the beginning, hello to you all. And I'm so grateful to be part of this wonderful community. And thank you, Hugh and Niti, for special consideration despite my last minute request. Thank you very much. And my name is Chihiro Sugiyama. And on behalf of the President and the local organizing committee, it is my great honor to inform you that 15th International Congress on Cleft Lip Palate and Related Craniofacial Anomalies The International Congress this year, Cleft 2025, will be held in Kyoto, Japan from 20th to 24th October, which is almost tomorrow. The scientific committee, scientific theme is harmony, looking for harmony and consensus in comprehensive cleft care and collaborative studies, which I believe harmonize with the COCP's, idea. And the program committee is currently working hard to organize keynote speeches and symposia, panels, and of course, the free paper sessions. And for the free paper sessions, we are trying to secure as many slots for oral presentations as possible. And as you all know, the last Congress was held in Edinburgh in 2022, and which was huge success, and in leadership of Dr. Felicity. And now we are working closely with her, and we are committed to follow their footsteps. And we believe that the key to the truly international Congress is inclusiveness and diversity, and that it must be the Congress that energizes the collaborative trend towards the world with access to quality, comprehensive cleft care in all countries and regions. And we believe it is important that speakers from diverse backgrounds and professions stand on the platform and present their achievements. And in particular, the Congress will be held in East Asia for the first time in its history. So we hope that this will provide an opportunity for delegates and colleagues from countries whose geography has previously made it very difficult for them to participate on site, and to make their research and clinical achievements known to the Cleft community and to build new connections. And yes, and it is thanks to the generous support of NGOs that this conference can be organized in this Congress is organized. COCP generously provides the COCP Award, an award for the best abstracts in the context of LMIC. The conference will be delivered online as well. And although it is not stated in the slides, we will have language support both on-site and online, and with translators and/or interpreters. And all of this is possible thanks for the significant support from Smile Train. And we have also received offers of support from Operation Smile, and we are very grateful for all the support, too numerous to mention here, and we are determined to make the best use of it to benefit the cleft community and, above all, the individuals affected by the cleft and craniofacial anomalies. And next slide, please. Thank you. More practical topics. The call for abstract is now open, and it has been decided to extend. And the new deadline is 31st March, and it will be officially posted on the official website tomorrow, very soon. Our tomorrow is actually today. So in a few hours, there's a notification of acceptance, and the beginning of the registration is as shown on the slide. And as in previous congresses, there is an LMIC rate for the registration, and welcome reception, coffee breaks, lunches. These are all included in the registration fee. And for more information, could you please click? Thank you. For more information, please search Cleft 2025 Kyoto and visit the official website. And this is my final phrase. Please spread the word about this Congress to your colleagues and enable as many colleagues as possible to share their wisdom and experience, and get in touch with new ideas and make new connections and renew old friendships. And we truly look forward to welcoming all you in Kyoto. Thank you.
Thank you, Chihiro. Wonderful. Excellent. Let's go on to the next slide, Kiara. So we're rounding the bend here. This is not even as far. We've talked all the way along the chat, and thank you for posting your ideas. We will capture all those and post them on Circle. Definitely share them with the Japan Organizing Committee too, in terms of some of the things that are really close to the heart of those of us who live and breathe LMIC comprehensive cleft care. But this is not the end of the journey for the solutions groups and the work that they've been done. So you'll see we started this, as Debbie alluded to, in late December, early January with the foundation. We've made it to the end of chapter 3, but where our commitment to you as participants is not done, we want to disseminate some of the work that's been there. So we are now going to bring our heads together, figure out which of the recommendations need to be revised or enhanced, or some other perspectives brought in. We will be looking at submitting some of this for the consideration in Japan. And then definitely the most important, I think, is that we want to give you these guidelines in a printed format, in a PDF form that you can bring back to your teams, to your government, to your public hospitals, and say, these are the kinds of ways that we're growing. Here's some internationally vetted recommendations for us to consider. And then each of you has that job, that really important work of contextualizing it, saying which of these recommendations is most applicable to our context. What are those next steps? What are the conversations that we need to have to push forward in comprehensive cleft care in this way? Because we know from the turnout today and from the amazing dialogue within each of these SGs, this is really important stuff. This is stuff that's animating us as cleft professionals in terms of how we want to better support families affected by cleft. So stage 4, stay tuned. Over the next couple of months, we'll be posting all the recordings of the roundtables, as well as these PDF guides that will be coming there. You can thank the SG members for that work. Now let's move on to the next slide. Very briefly, so we've already covered this, but thank you. We will be posting in the chat in terms of what came up in each of these roundtables in terms of the guides and resources that were posted. Let's move on to the next piece, and that is this. We're ending a little bit early, so I asked you all to guard an extra 15 minutes in your calendar, and this was my sneaky surprise. So please, if you can possibly save a little bit of time, complete a feedback survey right now. These are so important for us to make the case back to the NGOs that this has actually been effective, but also for us to shape, as Debbie and Brian and others are pointing towards, if we were to do this again, what should we be thinking about? So your feedback is so important. It's not going to take you that long to do, but please make that time that you've spared right now. Now, maybe Chihiro in Japan, where it's 12:30 in the morning, fine, do it in the morning. But for everybody else, if you're still awake, please take this extra time that you've blocked off for the conference to do your feedback survey right away while it's fresh. And then we'll have that. We will actually be demonstrating some of that humility and transparency by publishing, what the results were. If there's things that went well, things that didn't go so well, some of those key comments. So you'll get a sense of why we're asking for this information, because you'll see it in the conference report that will be available soon. So that's in your inbox, hopefully any minute now. Please do complete it. But before we do, we've got just one last thing to cover, and that is, as we've been seeing in the chat already, just the sense of how to use Circle. So Niti, please very quickly tell us a little bit about, if it's our first time on Circle, what it's all about.
For sure. I mean, most of you have come in from Circle, so I know that y'all have been exploring Circle and posting on Circle, and that's been great. We get to know so much more through y'all. So the conversation for the conference doesn't need to end here. Please continue your discussions on Circle. Beyond the conference, the COCP offers several other events such as webinars and journal reading clubs, all of which are hosted on Circle. So we hope to connect with you on Circle next. Please do log on immediately.
Thank you, Niti. Okay, next slide, Kiara. All right, and a huge thank you. So this wouldn't be possible without the work of our solution group members, getting up early in the morning, staying up late at night, and pushing this forward for 2 months sprint in order to present some research and some dialogue that's really thoughtful. We're so grateful to all of these people here. If you know them personally, or you want to send them a little note on Circle saying, I appreciated what you did, please do that. That's a lot of work, and they've done it all as volunteers. So we want to be really mindful of that. Thank you to the SG members. Next slide, please. We also, I want to acknowledge my team. So everyone's been working really hard, as you heard on the chat, but from behind the scenes, this is there. Also, thank you to Traducciones Remotas de Santiago de Chile for making it a seamless experience, I hope, for all of our Latino America or Hispanophone Latin America participants. So thank you for making that that way. And then let's move on to the final piece. Again, we couldn't do this without the NGO sponsors. You saw some of the senior leaders on this call. That's how important it was to them. We couldn't have done this without the NGOs, and that example of us all coming together, trying to move things forward, recognizing we all have this shared commitment to moving towards comprehensive cleft care for all. So thank you very much. We can stop sharing. There, that's the end of our official program. I've given you some time to do your feedback surveys. Please do it unless you're ready, really done. And then you want to think about it overnight and then do it in the morning, fine. But don't wait too long. We really want to make sure we get that data. So important for us in terms of building the sprint methodology, how it's working, but also this experience and how we can improve it for the next time. Thank you, everybody. We're really grateful. This is a lovely community.
Thank you, Hag. You're a very great showman. Yeah. Thank you very much.
Showman, thank you, Daniel.
Yeah. Thank you very much for all of you.
Great. And so there's a question in the survey. Where do we answer the survey? It should be coming any minute now in your email. We booked it in advance, so just it should be. Don't worry, it should be there. But you can reach out to us, info@cleftcircle.org, and someone's going to post that in the chat. If you have any questions about the survey or Circle of Cleft Professionals, please let us know. If there's other people in your world who should be part of this discussion, let us know. We'd love to reach out to them and say, great. And if you have a really amazing idea, and I think several were surfaced through the roundtables of topics that we should focus on in a webinar. I think Sarah Kilcoyne in particular kept pushing towards, hey, this would be a great webinar. We want to hear that as well. This is what the circle is all about. Circle of Professionals is about trying to learn together, and webinars are an important part of our gathering points that generate some of that momentum. So please feel free to let us know what topics you'd like to hear covered. If you have if you're volunteering some research you'd like to present, or if you have some ideas saying the next time you do Solution for Comprehensive Cleft Care, this would be a great topic to explore. Please, we're all ears. Thanks, everybody.